I'm Alicia, and I'm a nurse at Recovery Centers of America. RCA began in the pursuit of a singular mission: to save people's lives from addiction. As a nurse at RCA, you'll help our patients discover a life that is free from the struggle of addiction and into meaningful, lasting recovery. My colleagues and I are looking forward to taking you through a day in the life of an RCA nurse. It's a meaningful, fulfilling job that gets us excited to get out of bed each morning. If you're looking to make a real difference in someone's life, RCA is the place you want to be.
A day in the life of an RCA nurse starts with medication count on all controlled substances, followed by your team meeting where you'll discuss handoffs with the oncoming shift. You'll divide up tasks for the day, go over any medical changes, admissions, discharges, and patient reports so that all information is accounted for shift by shift. After the nurse team meeting, you'll participate in your neighborhood staff huddle, where you'll discuss behavioral concerns, staff and patient needs, and events from the previous shift. Our inpatient facilities are divided into neighborhoods so that our patients can work with a designated treatment team and peer community during their time in our care. Your neighborhood staff consists of nurses, counselors, case managers, and utilization review specialists that work together to give our patients the cutting-edge treatment RCA provides.
After your huddle, you'll start the patient med passes, which are primarily broken out into morning, noon, and night passes. The rest of your shift will consist of different tasks, including patient documentation, attaining vital signs, necessary blood draws, withdrawal assessments, supporting step-downs from detox to residential treatment, and managing patient medical needs. At RCA, we have an open-door policy with our nurses stations, so much of your day also consists of working directly with patients, having real, meaningful conversations with people who are going through a difficult time in their lives. That's why compassion and empathy are must-haves for our nursing team, and this also makes time management and prioritization critical skills for all of our nurses. Overall, our nurses spend around 40% of their day interacting with patients, creating rapport, and building a therapeutic environment that provides our patients with the best chance at achieving recovery. At RCA, our nurses and clinical staff work in a tight-knit, team-focused environment where collaboration and communication between departments is critical. Our patients rely on us to function as a team. At RCA, we don't say my patients or your patients, we say our patients. At RCA, you're more than a nurse. You sit and talk with patients. You listen and you help with challenges beyond just the physical. It's much more of a therapeutic, compassionate relationship than in other healthcare settings. Instead of doing the work for them, the patients do the work for themselves, and you're there to guide and educate. You're not just with a patient for a few days before they go home or to another unit. You give our patients hope over 30 days and see the lights turn on in their eyes as they begin the recovery process.
We place a high value on work-life balance, as well as personal and professional growth. Through the RCA Academy, our nurses can earn free CEUs towards licensure and exploring new areas of interest. We've had many nurses that started as CNAs or LPNs who are nurse managers and nurse practitioners today. RCA strongly believes that every team member should have the opportunity to develop and advance. RCA's full-time nurses receive full medical, dental, and vision benefits, flexible schedules, tuition reimbursement, PTO and holidays, a matched 401k, a flexible spending and health savings account, employee assistance programs, and much more. At the end of the day, we know that a happy, fulfilled employee makes a hopeful, recovering patient, and that's why we're all here in the first place. Life as an RCA nurse is rewarding, challenging, and inspiring. No one day is the same as the next, but we work through each day together as a team towards a shared mission. We are part of something that is changing families and communities. From day 1 to day 30, we see the light and life come back into our patients' eyes. We see them gain back their self-worth over and over again with each new patient. That is the privilege of what we do. That is why we get up every morning.
If you're interested in learning more or becoming a nurse at RCA, visit us at recoverycentersofamerica.com/careers or call 833-RCA-JOBS. We're looking forward to hearing from you.